Welcome, you're watching The Pulse, and on to some basic education certificate examination stories. 8 basic education certificate examination candidates from Nangbangu, Yapala, MA, JHS in the northern region may have had their dreams shattered in an instant after being involved in a ghastly motor accident. They were unable to sit for Thursday's paper, a twist of fate that could deny them admission into senior high school this year. Now, the candidates were involved in an accident on their way to write yesterday's paper at the Tamale Secondary School Examination Center. That's all. We've got the representative for the MP Amin, to speak to the matter.
603,000 candidates are
students. 8 students were involved. And as we speak now, 7 of them have been discharged with various degrees of injuries. And there is 1 person who is in a critical condition. He is still at the hospital here, and now he has been sent to a private hospital, Habana, for a CT scan.
So has there been any information about her condition?
Currently, as we speak, he is still in pain. His case is still serious, according to the doctor. And so it is the CT scan that would inform the doctors their next line of action. So tomorrow we don't know the fate of this boy, whether WAEC will allow us to bring the papers here for him to write, or what will they do. Because when we got there, in fact, the WAEC officer who we were told is the controller, he came and he was asking of medical report. We said this is not a case of sickness, it is accident. And because of the doctor's strike, when we even got here, the medical superintendent was not there. So, in fact, the immediate thing was just how to restore or to safeguard the health of these children. So that was what we all focused on. The doctors here were serious. In fact, so that is why I said I must recommend them. Those the nurses were on strike, but there were 2 particular nurses I recommend them, because in fact they were all over doing everything possible. And within the shortest possible time, they were able to pass the switches and do the dressings and even give them some medications to reduce the pain. And that was what even enables us to send them to the exam center. But as soon as the man came and took the papers away and said they are not writing, a lot of them started collapsing and started crying again. So in fact, we are calling on WAEC. We know that it is somehow it is against their rules, but in a situation like this, they should show human face. They should show human face. Nobody is saying they should bend their rules, but at least they should show some level of empathy. They should sympathize with these children and do not put their future into despair.
Now, with the candidates being prevented from writing their papers yesterday, the head of public affairs for WAEC, John Koppy, says the candidates can only write the missed out papers next year.
The candidates are able to get into the hall and then sit for the examination, even let's say for 5 or 10 minutes, and then we are able to confirm that they were at a health facility, for which reason they did not get there early enough to write the examination. Fine. Then the clemency case that the head of office mentioned yesterday could be applied. But as we speak, if what you are telling me is anything to go by, I don't have details of whatever happened there. But if they did not write at all, then there's no way any clemency could be applied.
Well, let's delve deeper on this. Divine Pe, he is an educationist and is joining me via Zoom. Divine, it's good to have you on The Pulse today. How have you been?
I've been good. How are you doing, Mifar?
Very well, thank you, Divine. And so, is this regular, where if a candidate is unable to sit for exam for whatever reason, the standard practice will be that WAEC would have to defer that exams to next year? Is it standard practice?
Yeah, it is standard practice. WAEC actually is allowed to grant clemency, but it is discretional. It is not a right any student wills. And so at any time that they feel like giving clemency, they can do that. And mostly they apply that during a case where a student is writing the exam or in the process of writing the exam, and that student or candidate falls sick and unable to continue with the rest of the papers. They are able to come in and determine, okay, the student has written out to some extent, and also based on their own statistical computation, they're able to allocate some mark to the student. Also, it also happens in other instances, but if the student is unable to write at all, in some jurisdictions, they can use the student pass record in the schools to estimate what mark to be given to the student. So clemency can come in different form. If the students were in the process of writing the examination and they fall sick, then WAEC can say, yes, they've written some, and we can give some percentage of allowance of mark to them to be able to also to get some considerable grade for their school allocation. Also, clemency can, as I mentioned, can also come in a form if they are unable to write at all for a special case, like the accident that we have heard about. In some or international best practice also allows that clemency can be estimated based on the child's school performance, and based on that, some mark can also be allocated to that. So WAEC wills the final authority as to how they want to proceed with it. But in this student special case, yes, they have not written the paper at all, so WAEC cannot base that or cannot determine what marks to be allocated to papers that they have not even written at all. But I think the clemency that they can enjoy is to write the paper, not to wait until next time, but we have special cases where candidates are able to write in private BECE. They can also be able to take opportunity of that other than joining their own cohort to write in the final examination that next year that candidates will be writing. I think they can take opportunity of that. But again, I don't think this should have been a very big issue before. If WAEC can approach, they may have their own policy, but if they can approach it with human consideration, I think these students, some of them say they can still sit for it in their hospital. And we have seen instances where during examination, candidates give birth, the papers are sent to them in their labor hall to write. So it should not be out of case if the students say, well, some of them are saying they can still write in the examination room. It should not be out of case for WAEC to make that special arrangement for them. Once they say they can do that, I think WAEC can approach this with human face so that they can sit for it in their hospital.
Well, Divine, I mean, I hear you say that it's quite discretionary, but are there not some things that we can use to trigger these discretionary powers of WAEC? Say, for example, what has happened in the northern region. Who or what actors and the roles can they play? The hospital, GAS, their parents, the school that they're attending. Can they play any role in any way in facilitating these discretionary powers from WAEC or by WAEC?
Yes, they have a very big role to play. First is to lodge formal complaint to WAEC and bring the situation to WAEC's attention, and then they can take it formally. I listened to the gentleman that you earlier talked about, that you interviewed. You see, he also was of the belief that WAEC should do something, but unfortunately, there have not been any official communication, and I think that's where the challenge is from, because I heard the WAEC official was demanding for hospital report. Yes, WAEC is right to demand for hospital report for their old policy situation. So if the respective authorities in the jurisdiction can take the formal process, notify WAEC, get a hospital report to WAEC, I think all of them can sit together to deal with this issue so that the few days that are left for these students, they can still take opportunity to write the remaining papers before it even ends next week.
I mean, I should ask you, overall, this year's BECE examination, what's the assessment so far, overall?
Yeah, I've had my ears on the ground. So far, so good. I think we've had some minimal level of issues of irregularities, but it is still distressing that we still continue to record, no matter insignificant they may be, we still record some number of irregularities, especially that it is coming under the blessing of teachers. Teachers spend years to teach their students, but they are ready to assist them to engage in examination irregularities. And I'm wondering, if you are going to assist them in a final exam, then why stress yourself even teaching them at all? So for me, I am still worried that teachers are still neck deep in issues of examination irregularities. But I'm very happy also hearing the WAEC PRO mentioning that they are committed to revising the WAEC law such that actions that they take against persons that engage in issues of examination irregularities become punitive. We have all come to the point to realize that there are different forms of examination irregularities that are emerging that the Act has not made provision for. And therefore, there's a need to revise the law. And then also some of the punitive measures provided by the law are not punitive enough. And therefore, there's need for them to be more punitive. So I'm glad that this particular exam is also bringing that out, that WAEC will be taking steps to revise their own law.
Thank you so much, Divine Claire, for joining us today on The Pulse. Now, today is International Day for Albinism Awareness, and my friends from the Ghana Association of Persons with Albinism today joins the global community in commemorating International Albinism Awareness Day, observed annually on June 13. This year's theme, demanding our right to protect our skin, preserve our lives, highlighting the urgent need to address the persistent challenges faced by persons with albinism, is calling for the association calling for immediate concrete action to end the widespread discrimination, ensure equitable access to sun protection products and essential health care, and safeguard the fundamental rights and dignity of persons living with albinism across Ghana and Africa as a whole. The association stresses that protecting the skin of persons with albinism is not merely a health issue, but a matter of life and death and human right imperative. Now, joining me in studio this afternoon is Andrews Kwame Daklo. He is the project coordinator at Engage Now Africa, advocacy manager at Africa Albinism Network. Kwame, it's a pleasure to have you. And how have you been?
I'm doing very, very well. It's been a long time.
Yeah, we shouldn't always be meeting when it is time to create awareness, right?
So I think we need to engage more.
I mean, this year, would you say that we have made progress as a country before we even get into this year's theme?
Yeah, to some extent, I would say Africa-wide, we've made a lot of progress. But if it comes to Ghana, in terms of awareness creation, some progress has been made due to the interventions of Engage Now Africa in collaboration with the Association of Persons with Albinism in Ghana. Yeah, but when it comes to government intervention, that is where the problem is.
Right. Let's explore some of the violations that persons living with albinism still face currently in Ghana.
Yeah, the major violations, much of them are based on discrimination and stigmatization due to misinformation and lack of information about albinism in the country, because awareness is not that much. Government is not taking that up, and it's only left with associations of persons with albinism and then non-governmental organizations. And in Ghana, unfortunately, we have only the Engage Now Africa that does that only for Ghana. And recently, Africa Albinism Network also came in to conduct research. They conduct a countrywide situation analysis of persons with albinism. And the report is under preparation. We are hoping to launch it this year. That will reveal the actual realities of persons with albinism.
Okay, what are some of the discriminations or the stigmatization that you face, practical ones that you face?
Yes, so recently I was interacting with midwives and nurses, also on a project to learn more about how they feel about when they meet people with albinism in the hospitals, especially when they are like the birth attendants. And they told me that sometimes when the child is born too white, they have that fear, like that kind of surprise moments comes with them. So most of them want to there's that announcement, like a friend will see a person with albinism being born in the world, and then they will announce together. So people come to see that child, and then in most cases, the mothers run into postpartum depression. But when it out of the hospital, on the street, you see children taunting and chanting, and there's this popular one, Obroni Koko March. Yeah, that is very popular, and people can chant that and then follow you all over the place with that song. And sometimes you are just walking on the streets on your own, minding your own business, and a mother with a disturbing child, will now refer you as a scarecrow, try to use you as a scarecrow to scare that child from doing a bad thing. So those moments kind of put people with albinism in their rooms and they don't want to come out. But now, because of the sensitization and ongoing, many are now kind of stepping out and then taking things by themselves.
And you will largely say that this is from the misinformation about albinism, right? You want to tell us about some of the misinformation that is out there about albinism?
There are several myths. I'm sure if you open the phone line now, people will call in to tell you that people with albinism don't die, they vanish. But that is totally not true. And they say sorry to say, if you have sex with a woman with albinism, you get cured of HIV.
Oh, wow.
Yeah, that is very popular. And then they say people with albinism don't go to the loo on Friday. Today is Friday. I wish we can do it on set, but that is not right. These are some of the myths about albinism. And the people believe that when you are born with albinism, it means that your parent might have gone to a god somewhere to take that child, to take the seed of the womb. And the result of that seed of the womb is you being born with albinism. A typical example was in the Central region, there's a community in Central region, there's a river goddess, and the people believe that all the people with albinism in that community are from the river goddess. And their parent has actually gone to that river goddess to take seed of the womb, and then that's the result of them having those children. So these things, these myths and misinformations lead to people behaving weirdly towards people with albinism. People don't want to associate with you because they believe you are a curse. Either your parent has done something somewhere, and then the gods are cursing that person, and then you are the outcome of the curse. The people don't want to share in that curse. And then there are others that people believe if they touch you, they might get the condition, but this is not like infectious condition. It is genetic.
My God. Kwame, I've touched you many times, and oh my goodness. But this is again because of the misinformation out there. So tell me that maybe there's somebody watching us who doesn't even know what causes it. You want to tell us what it's about?
Great. So simply, albinism it's a genetic, something that is in your blood, and it's inherited from both parents. So it's a genetic condition that leads to lack of melanin or pigments or color in our skin. So if you see the difference between myself and you is you have color, but I don't have color. But you can see the traces of that color on my face. That shows that my original skin, if I were to have the production of melanin, would be dark skin. But because my system don't produce melanin, I lack to produce color. So that is the only difference. So persons with albinism don't produce color, but everything about them is just as any other person, apart from the production of color. So that is one. And before a child is born with albinism, both parents, the mother and the father, must carry the recessive gene. It's a recessive gene transferred to the child that leads to the non-production of melanin in that child. So if the father is carrying the gene and the mother is not carrying it, there is no way they are going to give birth to a child with albinism.
Right.
Both of them must have that because it's a 50-50 contribution. It just works like sickle cell. The AS and ASS and those, if you follow that formula, that's how albinism also works. Both must have the AS for them to give birth to a child with what? SS. Yeah, if that doesn't exist, there is no way that's going to happen. I'm not a scientist, but this is the little I learned about albinism. My own
and obviously, Kwame, I mean, because of the works that I have done with you over the time, I know that one of the major challenges is the skin cancer that persons living with albinism. And you talk about it a lot of time when you have to create some awareness. What can we do to help the situation? I mean, as a country as well, the legal reforms.
Yeah, thank you for that question. It's very important. Skin cancer kills about 90% of persons with albinism. You know, there's this popular myth that people with albinism don't die, they just vanish. Simply because, one, is either that person is killed for ritual purposes or the person died as a result of skin cancer. And if you compare the death of skin cancer of persons with albinism, it's more than the number of attacks the whole of Africa-wide. Even a particular country statistic on the number of deaths for people with albinism who are dying out of skin cancer will be more than the number of people who are killed by others who believe that when they use their body parts in ritual portions. You know, currently the figure for attack is around 800 plus. Okay. But the deaths that we see every day from all the countries supersedes that. Maybe it can be 10 or even 100 times more than that. That means what? Skin cancer is the main killer or the disease that kills persons with albinism. And it's the one that give us the most, like, make most people with albinism more morbid, and the death also there, because the statistics have it that 90% that either die or contract the disease, they do that even before they reach age 40. Okay. Yeah. Okay. So what we can do, per your question, is basically protection. Persons with albinism just need protection, and the best way to prevent cancer or to protect us from cancer is the prevention. And there are several preventive measures we can adopt. The one that we are always hammering on, and the one that government can take, because I cannot ask government to go buy me long sleeves. Yeah. I cannot ask government to buy me long wide brim hats. Mm-hmm. But government can actually give me a bottle of sunscreen every month to apply on the part of the body that I cannot wear long sleeve or wide brim hat to cover, right? So that is what government can do. The simple step is government can put the sunscreen on the National Health Insurance screen or as part of the essential medicines list for all of us, so that at least those of us who are subscribers to that system can have access to a bottle of sunscreen per month. Other countries are doing it, like Zambia, South Africa, Kenya, Tanzania, Namibia. They are doing it. Why not Ghana? We can also do it. Currently, there's a huge advocacy around ensuring that the World Health Organization add the sunscreen to the essential medicines list. Okay. Yeah, so that is at the international level. Okay. But in Ghana, Ghana have to take that up and then add it to their the essential medicines list and make it available in pharmacies, in hospitals for persons with albinism to access. That is the major preventive area measure for skin cancer prevention.
Kwame, thank you so much. Always a pleasure having you in studio and talking about albinism. Thank you.
Thank you so much, Emufa. Nice to talk to you.
All right, and I see your president as well saying hello to you, Newton, the president for Persons Living with Albinism Association. Thank you for staying with us on The Pulse.